Hey mamas, welcome back.
Hello, can you hear
Testicles
me?
1, 2, testicles. Yep, they're working. Okay, so today we have the lovely Salome joining us. She is a scrub nurse and she is also a mummy to two beautiful little girls, and she's going to be sharing about her career as well as juggling motherhood. So...
Mama's Code.
Hi, how are you?
I'm okay. Had a really rough day today. Oh my god. Kiara's teething. Two teeth at the top, two teeth at the bottom. You can just imagine how that is.
That's not fun at all. Tell us a bit about your two birth experience. How was it? Because obviously for the first time round, we don't know what we're doing or what to really expect. So how would you say that it was different?
Obviously, being in the field of medicine, I kind of knew what was happening, but obviously because you don't feel it, you can't really understand it completely. I felt really sick with Evelyn, my firstborn. During my pregnancy, I caught TB while I was working in endoscopy. I used to do bronchoscopy, so camera is going down to your lungs to see how bad your tuberculosis is. And because of that, I actually got really sick. I actually got the disease. I had TB from when I was 3 months pregnant. I was in a lot of tablets and medications and all that stuff. And because she wasn't growing very well, she wasn't, all of a sudden her water stopped developing, and I had to get induced. So her birth is completely different. It took me 3 days for her to actually make an appearance, but it was really hard. It was the longest thing ever, and it was so freaking painful. But for Kiara, I was expecting the same thing. I was expecting a lot more worse. It was literally 10 minutes and she was out.
Wow. Didn't that scare you, as a first time experience? That didn't put you off? Didn't you ever think, oh gosh?
Having babies?
Yeah.
I didn't even want babies in the first place. Kids alone scared me. Just, where you hear people saying, oh, I'm pregnant and they're vomiting all the time and all that, the symptoms of it. I never really wanted to go through that ever. So I said to myself, I'm never going to get pregnant until I got married. And obviously in the marriage, everyone wants a kid. So I was like, okay, let's just have a baby. When I did, I didn't even think about the stories and the things that you see and all that stuff. It just didn't cross my mind at that time.
So everything you were seeing at work didn't really affect you?
Not even affect her, but she had to live it because like she says with Evelyn, she basically, in the field that she was doing at that time, she caught that disease. And TB is deadly.
Yeah.
So imagine being pregnant plus having this disease, you automatically think, shit, what's going to happen to me? And normally during a pregnancy, you want to avoid, you get a list of 1,000 things that you can't do, what you should watch out for. And then obviously she had it top tier. She went full in, yep, high risk pregnancy, here I go.
And seeing probably the worst case scenarios of TB, I'm pretty sure you experienced.
It is horrible. I've seen stuff that you just wish no one else will ever go through. But there was one thing I did not want to go through, and it's problems with the lungs. And I ended up getting it. It was horrible. And I had to have 8 antibiotics while I was pregnant. I had to have vitamins because they were killing my immune system. And I had to have something else for my liver because obviously when you're pregnant, your liver gets affected anyways. And all this medication that I was having was affecting my liver as well. So I had to have even extra medication. Extra check, extra blood tests. Oh God.
That sounds so hectic.
I found out I was pregnant with this thing after 6 weeks. And with the TB, they just told me it's fine. We'll just do a blood test. They checked the weather because they were thinking, because I had it on my lung, they say that it can get reactivated again. But so far it's been so good. And obviously when you're pregnant, your immune system goes down really bad. So they kept checking me and just keeping me away from all the high risk patients.
You'd think within the NHS, if you have a pregnant person, you'd keep them away from these patients from the get-go. But did you know you were pregnant whilst you were treating these patients, or did you find out far too late?
Yeah, I was. They did try to keep me away, but I remember this case so clearly. This really, really, really sick guy who had really bad TB, and he needed to be scoped. But no one else could do it apart from me. And obviously me being pregnant, even though they gave me all the gears and all that stuff, I still managed to get it. It could have been just because of him, or it could have been the fact that I was there for so many days. Because it wasn't just me that got it as well. It was one other colleague of mine. But because I had it, everyone had to get it tested. All the department had to get TB tested.
How did that change then when you got tested? Then what happened after? Did you stay away from work, or?
Because I was coughing for more than a month. They just kept thinking I had symptoms of asthma. Some pregnancies can actually make you have asthma. And because of that, they kept just giving me inhaler. And then till one day, they said to me, no, you need to go for an x-ray. The doctor that I worked with, thank God I was working with him, he looked at my x-ray and he just told me to spit in a pot. And then he managed to get the results 5 days after. What they did was called me. I was literally at lunch at work. They called me and they said, you need to leave work right now. I'll speak to your boss. I'll do everything. Just leave work and stay indoors. Do not speak to anybody, nothing, because you have a very contagious TB. Your family has to be tested and all. I literally ran out of work crying.
Oh, no. Just for anyone out there that doesn't know, TB is tuberculosis, right? Is that how you say it? I didn't know that was contagious.
Depends the way you get it.
Oh my God, I didn't know.
If it's on your lungs, which is the most highest place you can get a spread on.
I've got a friend that she got it and she nearly died. She needed like blood transfusions and everything because she was like on the edge of dying. And when she got pregnant a few months after, like it had passed down, and she was like literally dreading it because throughout her whole pregnancy, because she was high risk to getting it again, they tested her and kept testing her because any contact with the hospital, she had a chance of catching it. Even like on public transport, you can catch it. It's proper deadly. Like, I remember when you mentioned it, I was like, wow. Because I remember she looked literally dead. You know, like she literally went to the bone of how much she couldn't eat. She couldn't keep anything down. And she was just in hospital. She was in hospital for like 4 months.
That's crazy, because imagine that's someone that wasn't pregnant when she got it. So imagine now being pregnant and catching it. Your baby is already, regardless of anything, your baby is already taking all your... It's weakening your immune system because they need everything they can get from your body. So if you add this on top, it's like, I can't imagine how weak or ill you must have felt. Is that like a swelling of the lungs?
Basically, yes. Your lungs start to get like a mucousy type of liquid inside your lungs. So you're basically like drowning in mucus. It's really hard to breathe. And you're just coughing all the time.
How long did you have this for, like whilst you were pregnant? Was it the whole time or?
The whole time. So after 3 months of treatment, because of the liver and the fact that you're pregnant, they're playing around with antibiotics. After around 3 months of it, they told me, okay, you're okay to go on public. But I was on treatment for 2 years.
I wonder how they're differentiating it with like COVID. You know, it started at the beginning of the year, but imagine people would just have that and then now mix it. Like, how are they telling the difference with this? Do you guys think? Because it's almost the same thing, no? It affects your lungs.
Yeah, I think with COVID, it's a bit more rapid. It attacks your body a little bit more
faster.
More faster, yeah, and the symptoms of it are a little bit more harsh as well, because they're saying about really high temperatures or really low. And you just start shaking. And like with TB, I didn't have none of that. I only had the coughing. That's why they thought I only had asthma, because I didn't have the temperatures or anything like that.
Please know, and I just want to put it out there, if whenever I have a coughing fit, in my mind it's going to be like I have TB now. And I'm always going to go to Sally. Oh, Sally, I think I've got it now.
It's much more worse than that.
Can I just point out to all our listeners, this isn't the same Sally that we had a couple episodes ago.
For us and for everyone else, explain to us really what is a scrub nurse and what is your day to day?
scrub nursing, you basically work in theatres. You can work with, there's different fields in there. So there is orthopedics, there is trauma, there is emergencies, where you can have absolutely anything from, I don't know, from just a little abscess, like a big spot on your back, which we have to remove. That's the smallest. To something really major, like your aorta rupturing. We can have gynae, which is my favorite, gynecology, breast surgery. We have dental, ENT, which is ear, nose, and throats, anything to do with that. And then we have maternity, my other favorite.
How long have you been a scrub nurse for?
I have been in there for 3 years. I've been a nurse for almost 10 years, but in theatres I've been 3 years.
So how was that, like, when you found out you were pregnant, and obviously you've been in the field and you've probably witnessed however many deliveries, how did what you do affect kind of your idea of pregnancy?
It didn't really affect me. You get a little bit worried on your pregnancy itself. Like, I don't know, one day your baby stops moving and then you start poking your belly. That's how I was anyways. I kept poking my belly to see if it's still alive. Because you get all these scenes of what you see at work. So you do panic a little, but seeing birth itself didn't really affect me. I didn't like watching episiotomies, when they cut you.
Mm-hmm.
Yeah, they're the worst to see. So I really, really was hoping I did not get needed one of those with Kiara's birth, which I didn't. Thank God for that.
Why is that the worst to see? That's scary.
Oh, because it looks horrible. Oh my goodness.
Like slits in the vagina.
No, it looks horrible. It just looks like you've been
Oh my
butchered.
God.
I'm literally like clenching my thingy right now because it hurts.
That's how I feel every time that they said they're going to do an episiotomy, and I have to hand out the scissors, yeah? So I'm there giving the scissors, like, and then you hear this noise going.
Oh,
God. Stop.
I thought it was with the scalpel. Is that what it's called? I thought it was with that.
No, they do it with scissors.
Like cutting paper.
He actually sounds like it.
Oh my God, stop it. Oh, Jesus.
Do you know what the craziest thing is? I remember that when I had Maya and I was at like the last push before I had her, I remember telling the midwife, help me, cut me if you need to. I don't know, I got too cocky, but hearing this now, I'm grateful that I didn't need that because it sounds horrible.
I had an episiotomy with Evelyn, with my first one. She was getting stuck. She was coming out like that, sideways. So instead of them putting the clamps in to take her out, the doctor put her hand in and then gave me a massive cut, and the recovery for that is horrible. I even pity the ladies that have it done at work because it's freaking painful.
Is there like a average size, like amount that they cut, or is it just depending on the baby?
No, they only cut a little because there's a certain muscle you can't touch, especially when it comes down near your anus. If they cut that, then it's even worse recovery for the lady. They'll have to go through pelvic floor training exercise with a physiotherapist.
I had that.
Yeah, some ladies actually end up losing a lot of the sensation and the clenching, and they actually poop themselves after.
I haven't done that, but
I was gonna say, Erica, you pooping yourself all the time.
No, not yet. Maybe one day. But yeah, Joel ripped me from his head, I think it was just too big, and he ripped me all the way down.
He ripped you?
Yeah.
That's even worse than having a episiotomy.
It was just the worst. And I remember like the lady looking at Ollie and she was like, I'm gonna give her a new vagina, and I was like, who the fuck cares about a new vagina?
Erica,
I wanted my old vagina. No one asked for this new vagina.
Call their designer vagina.
Erica has a reconstructed vagina.
I literally do. The other day I was talking about these situations, and I was telling like one of my sister's friends that Joel cut me, and she was saying that when her daughter cut her, but not to that extent, but when they stitched her back up, her lips they put them in a little bit. And I was like, what? And she was like, yeah, like before, like my lips were a bit more out there, and now it's like more like flaquita. And I was like, oh wow, they go that, like, you know, like vagina surgery up in here.
Yeah.
I was like, oh, I didn't know they did that. I was like, no, my lips are the same. I didn't think they touched them.
Oh my god, I've got a friend that happened to as well. Like, she says that one side is a bit more like lifted than the other, like her lip. They don't care, do they, when they stitch you back up? They're just...
So far, the doctors I've worked with, they do stitch you up really well. They say that the midwives do it wrong. I haven't seen that. They don't really let them do it where I work. Only the surgeons do it.
Mama, I love you.
Did you give birth in the hospital that you work in?
Yeah, I did.
Oh my god, did your colleagues see your vagina?
No.
Oh, okay.
I wouldn't have minded though. I don't care.
Really?
Yeah.
At that point, you don't care who sees your vagina. I'm sorry, but I reckon like my vecinos could have all seen my vagina and I would have given two shits.
But imagine it's like Dr. Fred or like Dr. Smith cutting your vagina and delivering your child, and then the next morning he's like, do you want some coffee? Or like, I don't know, maybe he's someone that flirts with you at work, and then now he's like seeing your vagina in a not sexual way. Your designer vagina.
I think you become more like family. Well, that's what we call each other, work family. Majority of them are very older anyways.
So how was it when you walked, like when you were in active labour, or even the whole treatment, like your care? Was it any different because you're part of like the NHS?
No, I don't think so anyways. So I still had to book my appointments. I still had to wait. I still had to pay for my pictures. I still had
Oh my
to
god,
do all of that.
you actually had to pay for your pictures?
I think for one of them I didn't pay for. I think for the first one I didn't pay for. But that's because the lady said, at least get this from the NHS. We don't get anything. And she packed that for me. Yeah, it was for the first scan that I had. She gave me 2 pictures and packed up in the notes for me. She goes, shh, don't tell anybody.
I really want to know, like as a nurse being in that theatre room when a new life is coming, like how does that feel? Does it feel as amazing as it is when, I don't know, a friend has given birth, or when you were there? Like, no, I know it's not your child being born, but I also know that you build like this, like it's just a beautiful thing or anywhere, like in general.
I think so. If you was to walk in to have a cesarean section, the first thing you do is talk to your lady. So you find out a little bit about your lady. And whilst they're doing, like, you know, the cannulas and then the epidural and all that stuff, you just speak to them, and you end up finding out how they met their husbands, what child this is, how they plan the baby. Some of them even come for like IVF, and how special this baby is and all that stuff. So you build like a little bit of a relationship between you and your patient. So when that baby comes out, it still feels special. I don't know, for me, every single cesarean section anyways, I always have a big smile on my face, and especially if you see the couple that all they're loved up and all happy, sometimes you feel like crying.
I was gonna say, how do you stop yourself from crying? Because I don't think I would be able to. I think every baby I'll be like crying.
I'll be bawling my eyes out. I'll be like, oh my god, it's a boy.
Yeah.
They'll be hugging the mum as well.
I tend to bite my lip a lot, like cause some other type of emotion, so I won't cry.
Are you not allowed to cry?
No.
It would be a bit awkward. Imagine like Sally y llorando like, oh, can I carry the baby too? Like, let me get into the family picture.
I take the baby, because after the baby gets all wrapped up, the midwife normally takes the baby up to the daddy. But sometimes I'm like, can I do it? And then take a picture of the family. Not me though.
Sally turning the phone around to get in the selfie.
I remember we spoke before and you mentioned something about there's like a 13-minute time frame. Is this with all C-sections or emergency C-sections?
So we have a time, we have to take the baby out. So as soon as one, you had that epidural or spinal, the majority of them go down with spinal, has a time limit for the lady to feel comfortable with. So one, we have to look at that. So as soon as we start cutting, we've already started the timer, because we don't know what's going to happen. So as soon as we start cutting, we try to reduce bleeding as well. That's the time, that's why the time is there as well. And then baby comes out, again, we need to stop the bleeding, because like I said before, the womb has loads of blood vessels where you can actually lose a lot of blood. So we need to clamp them and then quickly sew them back up. The timer is there, one, to prevent bleeding of the mummy, and two, because as soon as we start cutting, that blood starts coming out as well from baby, because the placenta is there, isn't it, connected to the womb. So that baby needs to come out before it drowns itself, basically.
Obviously, not all of us are the same. So are there some women who bleed faster or more than others? And let's say when you cut them, it becomes apparent that you need to act even faster than you would.
Yeah. So there are some ladies that get clexing, or some ladies that have diabetes, or certain different type of illnesses within your pregnancy or just out of the pregnancy. Especially the ladies that have been taking blood thinners, clexins, they are the ones that we worry about. So yeah, we have to act faster because of mum more than baby.
So I was talking to we were talking to our friend, and we were mentioning, that you have to sign a disclaimer form just in case the doctor cuts the baby. And no one could really believe that, because they were like, you've studied for this. But then we were trying to explain what you explained to us. So kind of like give us a bit of background on that, because obviously our friends were like, nah, that can't happen. But if you kind of give our listeners a bit of background detail on why, and maybe like for me, like I remember that day when you told us that, I was like, no, but you're going to take no responsibility for cutting my baby's face. But now that obviously having more light in towards that conversation, I can understand why it's a possibility.
The form itself doesn't say we don't take responsibility for it, whatever's going to happen. If you read through whatever, like even when you get a coil inserted, they will explain to you the risks of having one done. And that includes infections and, damaging your womb. The same happens when you're having a cesarean section. Having a cesarean section is actually a major operation, because anything can get in the way, including your bowel. So let's say your lady gets a spinal in, and as we are cutting, she reacts to the spinal, making her more, more high risk, or what you call it. So the doctor will then have to act upon it. And if that happens, where a bowel gets on the way, or majority of the cases is the bladder, which gets on the way of us cutting, we don't even cut near the bladder. We actually separate the muscles from the bladder. But sometimes, because the bladder is very thin, it can get on the way and split. Stuff like that can happen on a major surgery. So that form itself is just saying, if there is to have an accident like that, we will act upon it, we will fix it. But obviously, like I said to you, they go blinded and they act on the situation. So if the baby, sometimes, like I said, we are cutting and the baby somehow moves, we use a blade, but we don't cut. Like, when you're cutting meat, you press the knife down. We don't cut like that. We literally just touch. We don't even press down. They literally just touch little by little, going down the womb into where you see the sac. And they sometimes don't even touch it with a knife. They just use their fingers, or they use another type of equipment using the forceps. But I have had where the lady, the surgeon, just touches the womb and the sac of water, and the baby got a little scratch on the forehead, but that's it. It's not like a massive cut.
Oh my god, like Harry Potter.
I wouldn't even mind if when something happened like that. So you say that you cut. How many layers is there?
Loads. So your womb's a massive muscle. It's like an onion. It's a massive muscle with very thin layers, but there's loads. It's like that thick. I have grabbed it before.
But you know when they're cutting, so does every little cut start opening by itself?
Yeah.
Or do they stay together though?
No, they literally start
separating. That's what I kind of thought. So when you're stitching it up, it's like you're stitching different little cuts. Or do you just stitch one big one?
No, they just do one little one. So literally as small as like that length of my finger, literally just tiny. I would say like 1.5 centimeters cut, even probably less, depending on the surgeon. But they literally cut a little bit, and as soon as they're in there, they use their fingers to prevent any more damage. They use their fingers to separate it, and create as big as of an how do you say orifice, like a hole, a big enough hole for the baby to come out.
That, do you know what's crazy? The fact that, well, some mums feel like they're not real mums because they didn't give birth vaginally. So, you know, there's a lot of people that say, oh, you know, if you didn't give birth through your vagina, then, you know, you didn't really go through the pain. But it's like, you've put your life on this hospital operation theatre bed, and you've literally practically sacrificed your life there to bring your baby to life, to this world. Yet you get negative Nancy saying that you're not really a mom because you didn't give birth vaginally. That to me is absurd. Like, you've just said to us, this is a major surgery and you know how many layers go. It's beyond me, no? That people say such things.
I don't think that's fair as well, especially if they don't know exactly what's happening. Like I said, they actually like rip you apart in order to get to your baby. Even like, you know, when they're laying down and they can't feel you, but they still feel, they have a sensation still. They don't feel pain, but they feel the tugging, and you still hear the lady complaining and going, ah. And afterwards as well, their recovery, the pain that they go through, I don't know how they do it. It's just by looking at what they go through, to me, is painful. Imagine just an episiotomy is painful. Oh, I don't know what they'll go through because their muscles have to go back together. Oh, I don't know.
My mum gave birth to my little sister like via C-section, emergency C-section. She used to say that when they were trying to get like my sister out, she could feel like her whole insides move. And she was like, it wasn't painful, it was just uncomfortable because it's this weird sensation of like literally a hand inside you moving your organs left, right and center.
Yeah, I have a colleague that after her cesarean section, when she had it done in Romania, she said that she couldn't feel, she had no sensation on her lower abdomen. So even if you pinched her, she didn't feel it. So I don't know how they done it, but still, imagine having had a baby and not being able to feel that, and then being told that you're not a real, like, you know, you didn't go through your vagina, so it's not fair, is it?
Like years back, so like say moms, grandmas in Colombia, they do the C-section like downwards.
Yeah, oh god.
So my mom, she now, like, I'm a grown-ass woman, like just 15, but she says that if she puts like a zip on her C-section, it still hurts her. Like, she just, because it's very set on, she's had 2 in that same, so trip twice downwards. She says it's still very sensitive, and she says when it's really cold, she just feels like a weird sensation going down her belly. And it's so weird because it's like so many years have gone past and you'd think, you know,
you still feel it.
No,
yeah.
and like going back to what Jess said, that, you know, some people criticize women that have C-sections, but women in itself like give themselves a really hard time because of the scar that they have. Whereas, you know, you kind of have to see it as a miracle, because try to see the journey you went through to bring this baby into the world. And also, I think, enlighten yourself that you were born in a generation that, you know, say like where the hands of doctors are like literally God's hands, because the amount of women that go in and out of theatre through C-sections, I can't bear to imagine how many C-sections a doctor goes through in a day. And like most C-sections that I've seen, the line is really thin, like you could hardly see it. And then I think, you know, if you look at people in Colombia, like I remember my grandma used to have like a horrible scar, and women like that, obviously it's more difficult to hide because it's down your belly. It's not like you can hide it in your knicker line. So it kind of like taunts me, like, you know, some women, you know, really give themselves this hard time because of this scar. And like, I can understand, you know, it's you just feel outside of your body. If we don't have scars for bringing our children to life, but, you know, we have like maybe like a roll here or there, or saggy skin, things like that, and it puts you off, I can understand. But I think in all its ways, we should be grateful that we're not basically botched the way they were back in the day.
I think all mums should be grateful, no matter how you give birth, how you feed your baby, or however many scars you have in your belly. Because I mean, if it's not a cesarean section, we get stretch marks. I hate stretch marks, but I got them. We should be happy because one, you brought life to the world. Not every woman can do that. Not all of us have been given that opportunity to actually do that. We should love our scars.
It's the same as like when you're given, well, when you come out of your C-section and you still feel a bit, you know, like shit about it. It's like you actually came out of your C-section with life and with your baby alive, because I'm pretty sure I don't know if you've seen any of the cases, but you know, you're going in there not knowing if you're going to come back out or with your baby, and especially if you're running in there like an emergency C-section. The dad is putting you and the baby up for chances basically, because you may not come out of there, or you may come out with no baby. It's so sad.
Just giving birth alone is hard. We had a lady who came in to have her sixth baby. Is that how you say it? I think I said it right. Perfectly fine pregnancy. She gave birth absolutely beautifully, but she couldn't stop bleeding. And we tried to stop her bleeding, but we couldn't stop the bleeding. So at the end, we had to remove her womb. So even though she gave birth vaginally, you just never know what can happen.
That kind of leads us on to one of the questions we had. It was, how do you detach yourself from scenarios and cases like that where things don't go to plan? Because I think, you know, for a doctor or a nurse, you always want the best outcome, right, for your patient and the new life. So how, from experiences that you've had, how have you detached yourself from that?
We have to look at always the positive side of it. So like that lady, I kept asking because I didn't know what was going on. I literally got called up. I had to run upstairs and literally someone was dressing me and quickly getting all the equipment out. And they were saying, hurry up, we're losing her. And I was like, what is going on? Like, what am I doing here? And they were saying we need to stop the bleeding or remove a womb. And I was like, okay, but where's the baby? Because there was no baby in the room. So in my brain, I just kept thinking, oh my God, we've lost the baby and now we're losing a lady. So I was really nervous, but I was trying to find out what is happening. And then I found out that the lady, once things calmed down, that the lady had already 6 babies and they were absolutely fine. So in a way, I kept thinking, at least if we save this lady, that baby will have a mommy. So I kept thinking, it doesn't matter about the womb, as harsh as that sounds, but I kept thinking, at least that baby will have the mommy. So as soon as that lady was stable and left, you just start thinking like, oh my God, it could have gone any way, but you just think positively and think he's got his mommy and the baby's okay. When we lose a baby, I tend to not show any emotion at work, but I do tend to cry on the way home just to let it out, I guess. And then that's it. You just get home and kiss your kids.
Mate, my eyes are watering just thinking about it. I don't know how, you know, everyone, you know, when you work, you have crap days, right? And that for you might be your bad day at work, but your bad day at work can't really compare to like someone else's bad day at work. You've literally either seen a life gone, and like you said, you make that relationship with these women when they come in, so you don't know what their journey was to have this child.
Yeah.
And then now that child isn't there, like, and then you have to pick yourself right back up because maybe the next day you have work and that's it, just another day.
Yeah, it's really hard. Really hard. We've even had surgeons crying. We were so surprised that this surgeon cried, but she's been in the army and all. She's one of them women that show no emotions. She's just really tough and treats you really tough. Surgeons can be very horrible, but she's one of the scariest women I've ever met. Everyone's scared of her, but she's really good at her job. And there was an emergency where she couldn't do as much as she wanted to, and the lady passed away, that she actually burst out crying on the table. I thought, oh my God, like this lady actually has emotions. But the whole room, when that happens, everyone just becomes quiet. They just don't show emotions. When that baby died, we all just stayed quiet. Everyone had red eyes, no tears rolling down, just red eyes. We just kept breathing and just leaving the room, coming back in, like taking turns. But no one cried until that lady was gone. I didn't cry. I only cried when I got home. And I cried to my husband. I think he's the only one that actually listens to my stories. He's like, oh, it's okay, baby, have a cup of tea. And that's it.
I think, Erica, you said something really good. You said that we see like doctors' hands like God's hands in a way, right? Sometimes it might be hard that we forget that doctors are humans. They're like you and me. They also have emotions, but they're doing a job so precious, I think. And I can't imagine what a doctor or a nurse in a situation like that will like feel, because it's your job, right? You're doing your job, and at that point there wasn't anything else you could have done. How do you then just kind of say...
Well, kind of picture it in, like, say, like a sales perspective. Like, we work in an office, right, and we lose a deal. We're angry and we're frustrated.
Got it.
And sometimes, like, I've seen the sales guys in my office that literally livid if a sale doesn't go to plan. You know, they lose millions. That's money. Money goes like this. Imagine Sally and, like, every single surgeon and other nurses she works with. It's a life. A life. Nothing can replace a life. The feeling you feel when something goes wrong to the feeling they feel when, you know they're losing a life, it must just be out of this world. Like, I can't even put myself in that situation, because I think when we felt like, something's gone really bad, that's just nothing compared to what anyone in the NHS feels when things don't go to plan.
It's almost like in that room they feel defeated. We see it in the films, and I'm pretty sure in real life it's even like 10 times worse. Like, they fight until the very last minute, that's it, there's no more you can do. And it's almost like coming to terms with, there is nothing else you can do, you've lost this life. Like, can you imagine that weight in the room?
Yeah, when that does happen, it's not only the doctor's decision, it's everyone in that room's decision. There is a red phone in every single room that has emergency that we hate. But when we have such things like that, we have to call everybody in. By everyone, I mean everyone in the emergencies, like porters, blood banks, and the matrons, the consultants. We have to call them all in and then say what's happening, and then we all have to agree with one decision, which is to stop or carry on. They train you for all this, but when it actually happened, and it happened to me that day with that baby, I was cramped for it. I didn't know what to say, but they were all looking at me, and I was the last one to say. I was like, what? I don't want to say okay, because, like, you just want them to carry on. But you kind of have to say okay, because there's nothing else that they can do. So yeah, I just turned around and I said okay, and then that's it. They just stopped. Everyone stopped. But it's hard.
I think we're all lost for words, really. I don't know. I mean, we try to kind of put ourselves in that position. There's this documentary currently on BBC iPlayer of Stacey Dooley, and she went behind the scenes with the NHS of women giving birth during lockdown. And there's a moment in the episode where a baby is born and it's not breathing, and the camera literally runs out. And at that moment, like, I was sitting on my sofa, and at that moment I was just like, oh my God, like, the baby's not responding. And you can see they're working on it. You see Stacey Dooley in one side, and then all of a sudden the baby just starts crying. Stacey started crying. I was crying. The camera crew was crying. Everyone was crying, because, I mean, and that's me watching through TV. Like, can you imagine all of that going through, the adrenaline, the emotions, everything in that room. Yeah.
Yeah, you just become numb. I think that's how I call it anyway, the numb moment, because you go in there, you're doing your emergency, and then all of a sudden your body just is just doing its work. And then once everything, like when you hear that baby crying, oh my God, it's like, oh, you just come back to earth kind of feeling.
Sorry if this is a bit tough. Have you ever had a mum die?
No, no, we've had to put her under anesthetic. That's about it. She reacted badly to the spinal we gave her, like allergic to reaction to, because they gave you a number of medications to make you feel okay. And we had to put her under anesthesia. We haven't had no ladies passed away. Touch wood, I do not want to experience that.
I don't know how you do it to not cry in there. That's a job in itself, to just hide your emotions.
I think they get trained to keep the tears back, or they're not allowed to drink water to not produce tears.
You just get numb. You hardly have time to get water anyways.
In every single job that we do, we always know to keep it professional and keep, our emotions to a side, because that's work and this is our life. The same way as when we get home after a stressful day, we've said it before that sometimes it's hard to disconnect at the door, but you take a deep breath, you go into your house, because that's your sanctuary, that's where your family is, that's where your peace is. But getting there, knowing that this has happened, or whatever day you've had, coming home to your children, knowing someone is not going to have that.
Well, imagine sometimes we get emotional with films, and especially when I see like films to do with babies or I don't know, I go to sleep dreaming of it and I just can't let go. So I can't begin to imagine working in what Sally works in and trying to come. I'll be a mess. I promise you. I think I'll go first day and I'll be like, yeah, sorry, it's not for me. Thank you for the opportunity.
You get more good than bad.
No, I don't think I'd be able to cope, because I'm a crier. Like, I will cry because yes and because no. I'm literally that person. So I think I see blood and I'm like, oh my God. And also I'm an overthinker. So if I'm hearing all the doctors, I'm sure it happens that they start talking and they're like, oh, this is happening and this is happening. Oh, there's too much blood. I'll be like, oh my God, she's dying. Oh my God, someone's going to have to go outside and tell the dad. And I literally will be like, no, it's not going to be me.
The doctors don't do that.
Do they not? Oh my God, thank God, because I would never.
It's actually the scrub nurses.
Oh, really?
Yeah, the doctors are literally quiet.
Do you have to wipe their head?
The scrub nurses can actually do a cesarean section.
Really?
Not to. Because we have to know the process of it. We have to know even before they want something, because some of them, they just stretch out their hands and they expect you to know what to give them. So you have to be looking to see what's happening. And if there's bleeding, you're supposed to have reacted before they have. So if there's bleeding, you will need such thing. Unless they ask for a certain medication to inject directly on the womb, then you should know what to get before they even ask.
No pressure, Sally.
Exactly. At the beginning of it, when I first went up to maternity, just as I got there, the bell started ringing and my mentor was like, okay, we're getting an emergency, quick. And I literally froze. I didn't know what to do, because this was the first time I've been to a maternity emergency. So I stood there, and I'm not gonna lie, I was as white as paper as she described me. And frozen in the corner. She was her name was Sally. She said to me, just stand in the corner. Just don't look at anything. Just stand in the corner. Are you gonna pass out? I said, no, I'm fine. Do you need me to do anything? She was like, no, just stand there. Don't do anything. Because apparently I was as white as paper. I actually froze. I didn't know what I was doing. And I went home and I was like, oh my God, I don't know if I can do this. Because it's really hard. They know exactly what to do. You just know, as soon as that bell rings and they're saying this person's coming down, they know exactly what to do. The doctor just has to get there and do it.
Oh my God, I was just about to ask you this question, that because it happened when my cousin was born, that her heart rate was going down. And my cousin, so the baby's dad, saw when they pressed the red button in the room when his girlfriend was like giving birth. And he said it was like out of a horror movie, like about 100 doctors rushed in the room, and he was left in the sidelight not knowing what was going to happen with the baby, what was happening with the mum. Like, how does that feel when you know that button has gone off and you're going into this room not knowing what's happening? Like, because you don't know, right? Until you get in there.
Yeah, until we get in there. Majority of the time, as soon as the button goes off, we all run in there. But I tend to go straight to the dad and say, don't panic, we are all here. And the more you see, the better. Because obviously the dad's just standing there like, oh my God, what do I do?
Why is there so many people going in?
We don't know who's going to be needed. And the more hands, the better. So when that button goes in, like I said, everyone gets alerted. The scrub team, so we'll be running up there just in case the lady needs to go into theatres. There's obviously the surgeons, then the midwife that was looking after her with a healthcare assistant to help her out running around, and whoever's free will be in there just to run around.
And then you'll have Erica in the corner like, oh my God, there's so much blood.
I'll probably be screaming like, guys, stop.
Before I went on maternity leave, they had us on this training saying that not everyone should go in the room, just one person. So they are now, I don't know if they're doing it in every single hospital, but where I work, they're only sending one person and everyone else waits outside. And whoever is needed then gets told by that person to stay.
Mama's Code. Thank you so much for sharing your experiences. I think definitely we've learned a lot, and we were on the verge of crying, if not cried a little. We love to kind of wrap an episode up by asking our guests for a golden tip. Like, what would be the one thing you might tell a new mum or an expecting mum?
Just to enjoy it. No matter how negative things are, just to enjoy one pregnancy, the birth, everything, the afterbirth, and your kid. Just to enjoy the experience, because like I said, not everyone gets given that opportunity, and not everyone goes through it to the final stage. So it's better to just enjoy every single moment, no matter how low you feel.
Thank you so much. That was so interesting.
Thanks, Ali.
No problemo. It's nice talking to you girls.
See you for the next drink up.
Yes.
Mama's Code out. Mwah.
Mama's Code.
See, when we get paralytically drunk, we have someone to help
I'm not
us
worried
out.
anymore.